Well, things are not going so well anymore, and it's still worth it going through it all. It's just really hard. Hey guys, it's Angel and welcome back to my channel. Today I'm going to be doing my 34-week pregnancy update. I'm actually pretty close to 35 weeks at the time that I'm filming this, and I'm sure I'll probably be at least 36 weeks before this is posted to my channel. In fact, I have not even finished editing and posting my last update, which is when I was 32 weeks, I think. This video may come as a surprise to you because it's kind of out of nowhere. Since the last update, everything was going so well, so smoothly. We were both really healthy, doing really well. It was so optimistic. We were really planning for a full-term birth. Both the midwife and my MFM were totally confident that we'd be able to make it that far, and then things really took a turn. And so it may seem very sudden and out of nowhere to you, and well, that's because it was very sudden and out of nowhere to me and my doctor. Last I left you was after I had the MFM appointment and I was doing well, and I was about to have my next appointment with the midwife to talk about what happened with the MFM. So I had an appointment when I was about 33.5 weeks pregnant. I remember some things had been going on over a couple of days prior to that I kind of felt off, but I just kind of chalked them up to just pregnancy being weird, because, you know, towards the end of pregnancy you get uncomfortable or you have weird symptoms of things that may be totally normal and not mean anything. So every appointment, the first thing I do when I get there is go into the bathroom. I do the little quick test strip to look for sugar and protein in my urine, and I also weigh myself so that I can give that information to the nurse. So then when I get called into the exam room, it's always started out by the nurse, and she'll ask me how much I weighed and what the test strip looked like, and then she'll take my blood pressure, and then she'll do a really quick little ultrasound just to confirm the baby's position and get his heart rate. So I already started to have an inkling that maybe things weren't going so great, because my test strips have always been negative, and this time it was a little bit green, like, so basically trace protein in my urine, and I always know that's usually not a good sign. Next, she took my blood pressure twice and didn't tell me what it was, and she looked kind of worried, and I was like, uh-oh, and she said that she would have the midwife take it when she came in, so I knew that was probably not a good sign either. She did the little ultrasound. He was head down still, which was great, and his heart rate was good. He was looking good. All right, awesome. So the midwife, Becca, came in a little bit later. She took my blood pressure in one arm, still didn't say anything. Took it again in the other arm, and then I'm like, okay, what is it? It was 136/110, which is bad, you guys. That's pretty dangerous, and that coupled with the protein really is not a good sign. And so she went to call my doctor, the OB, to see what he wanted to do, what his plan of treatment would be for that, and she couldn't get a hold of him. So she came back in and we finished the appointment, and she said that she would make sure to get in touch with him as soon as possible, and that they would call me and let me know what he wanted to do next. Looking back is when I realized, like, okay, yeah, I've been feeling kind of off. I've, you know, been kind of dizzy sometimes, or like I noticed I had decreased urine output, which is another symptom of that. I've been having some kind of pains up here in my upper abdomen that kind of feels like when someone punched you in the stomach, and you get kind of that weird pain / wind knocked out of you kind of feeling. It's kind of hard to describe. Just different things that I didn't really put together to realize it was all related. That's because I just wasn't expecting to have any problems with hypertension yet. I did have pregnancy-induced hypertension or gestational hypertension with my first 2 children, maybe even considered preeclampsia, depending on what criteria that you feel would be necessary for a diagnosis. Neither of my first 2 OBs officially diagnosed it at preeclampsia at any point, but it could have been, or at least it was headed in that direction with both of them for sure, because in both of those pregnancies it was getting worse and worse as time went on, and I was getting more and more of the symptoms, like a lot of swelling. With both Caladan and Kerrigan, I didn't have any blood pressure problems or any of the symptoms at all until about 36 weeks or so. So I was really not expecting to already be having high blood pressure at 33 weeks, nor was I really expecting for it to be quite so high, because it actually was higher than I have ever had it. The 110 in the diastolic is very, very high, and that is very scary. And she sent me down to the lab to have them do some blood work and a urine sample to see if there's any signs of preeclampsia. Anyway, so I did the labs and I left, and about an hour, hour and a half later, when I was waiting at Cal's school to pick him up from school, they called me and told me that my doctor wanted me to start on labetalol ASAP, like that day. They'll call it into the pharmacy, that he would want to see me a week later to see if it's working, and also to do that ultrasound. Now, I took labetalol when I was pregnant with Kerrigan. I think I was started on that at about 37 weeks. So when my blood pressure started rising with her, it started off being just kind of borderline high, and they were just kind of keeping a close eye and started doing NSTs, and then it got higher and higher, and once it got to a certain point that made my doctor worried is when he started the medicine. So this one, again, like I said, is higher than I've ever had it, and so yes, my doctor was all about getting started on medication right away to see if that would help. This time I'm taking it twice a day. Last time I'm pretty sure it was only once a day. So throughout the week, you know, I just kind of feel off, and I would like have headaches, and sometimes I'd feel dizzy. I went in to my appointment and I took my blood pressure more than once, and then I was like, uh-oh. Now luckily my urine test strip was good. It was pretty much negative, but my blood pressure was 136 over 92 or 132 over 96, one or the other. So not good. Still not quite as bad, but definitely high, and definitely problem, especially considering that I had been medicated for it all week. And so they're a little concerned that the medicine is not working, and I'm definitely concerned that the medicine is not working, because it did work really well last time. So we kind of have like a 6-step plan here. It's just been kind of a whirlwind for me, and I feel like very complicated feelings about it, because on one hand I feel very relieved, and on the other I feel very anxious and worried and scared, and just this isn't how I wanted things to go. It's just really disappointing to be going through this again. We tried to prevent it with the baby aspirin and the tinctures and everything. I thought that maybe for once I would get to have a pregnancy without this happening at the end. Especially, you know, just because you've had it before doesn't guarantee that you will again. You actually have a better chance that you won't have it again than that you will. But I also know realistically, because of my autoimmune condition, really increases your risk of hypertension and even preeclampsia. The risk of preeclampsia triples. Even though the baby aspirin has been demonstrated to lower the risk for women, it doesn't lower it by a whole lot. Out of like 100 people, about 5 of them won't get it that would have maybe gotten it before. So it's not a huge significant reduction in risk. It's definitely still better than nothing. It's definitely still worth trying, but it didn't work for me. Between bleeding in the first trimester and hypertension at the end, I don't know what it's like to have a normal healthy pregnancy, and I'm really jealous of people who do, because it just makes it so stressful and scary, and it's still worth it going through it all. It's just really hard. So the plan is that baby boy is getting kicked out by 38 weeks on the dot, which is March 13th. And that's assuming things do not get worse. It's just all of the risk factors, everything stacked up on top of each other. It's just too risky to wait any longer than that. My doctor is a huge advocate of waiting until at least 39 weeks in pregnancies whenever possible, because there is such a difference in development for babies between 37 and 39 weeks, and the outcomes for them are so much better. But sometimes it's just not possible because things are going wrong and it's just not safe to wait that long. So between the gestational diabetes and being on insulin for that, which already is a bigger risk, there's also this issue now with the hypertension and even potentially turning into preeclampsia. And it's just, and I also, you know, am a VBAC patient. Just waiting is just not good. It was really sweet though. He looked at my chart and he's like, oh, but he's not going to come back until after 39 weeks. So when they noted, you know, when my husband was originally scheduled on an underway, he wasn't going to return until a couple of days before my due date. And that really meant a lot to me, especially knowing what I know in the few interactions that I've had with Dr. B and hearing people talk about him. He does not have the best bedside manner, and that's why he has Becca and has her doing prenatal appointments, is he does want to provide that personalized and like caring, you know, care for his patient. Like, it really touched me that he cared about my husband not being there, and that like he wishes he could have waited that long for him to be able to be back. But that we just couldn't wait that long. But the good thing is my husband's underway schedule did change, so he is not going to be gone until then. In fact, he's actually not leaving until then now. He's home now and he's not going to leave until right before my due date. So this actually works out better with what his schedule is set up to be now, for us to be having the baby early instead of waiting until 39 weeks or even 40 weeks. So because of just that is one of the huge reasons why I feel relieved, because I knew that he was not going to want to be inducing and delivering earlier than 39 weeks without a compelling reason. So I knew there wasn't a way to just like, let's just get the baby out so we can make sure the baby will come before he leaves. And so now we have a reason. Not that anyone ever wants to hope for preeclampsia or something being wrong. Becca had mentioned at my previous appointment that if it was indeed preeclampsia, that he would probably want to deliver at 36 or 37 weeks. Since it hasn't quite gotten to the point to be for sure considered preeclampsia, I'm kind of in this gray area because my labs from the previous week were normal, but I am having some symptoms that might be concerning. They ran the labs again. This time they did it stat so that they can see if anything has changed, but at least we have like a baseline from the previous week. But his plan is 38 weeks on the dot is the longest we're going to push it, and that's assuming everything still goes as well as it's going now. Of course, if things really take a turn and the baby starts not doing well, or things start getting a lot more dangerous for me and my condition, then we will probably take him out earlier. For now, the plan is I'm going in for an NST on Wednesday. So when I am 35 weeks in one day, I'm gonna do an NST, make sure the baby's doing well. Then the following week on March the 1st, I'm going to be having another ultrasound. So again, to check on the baby and also to check on my scar. Now, my scar looked really good in the last ultrasound. Like, she made a point of it. She's like, this looks fantastic. It looks perfect. So he just wants to like double check that it's still looking good for him to feel comfortable with an induction. Assuming that my scar still looks good at 36 weeks, which I don't see why it wouldn't, considering I have had a successful VBAC and it was augmented with Pitocin even, and I still did not have a problem. So I'm pretty sure my scar is good. But assuming that goes well, then he's going to be checking my cervix on the 12th of March. And if my cervix is favorable, then we will go ahead with an induction. If my cervix is not favorable, or there's just some reason that he doesn't feel that an induction is safe and that he needs to come, then we will have a C-section, most likely on the 13th, maybe a couple days later, depending on our conditions, how emergent it is. But I'm pretty sure 13th is like the latest he's going to be coming, one way or another. I'll either be in labor by then or have a surgery by then. And I really don't want to have another C-section, especially since Justin will have to leave when I'm still like recovering from surgery, when it would still be hard for me to drive and carry heavy things and do things on my own without someone there to help. And just, you know, having to take care of 2 other kids, and just it's hard to recover from. It was hard to recover from last time, but at least all I had to take care of was my newborn. And this time it's just a lot more on my plate, and I'm a lot older and I have more health concerns and everything, so it's scary. And I just really don't want to go through that again. Like, emotionally, I'm still processing and working through the birth trauma from Kaladin's birth, and I'm afraid that being in an OR again is going to be very triggering and very hard for me. This is my last baby. I didn't want it to go out like this. Like, I didn't want my last birth experience to be hard like this. I'm very grateful now more than ever about how well Kerrigan's went, even though it wasn't exactly what I would have wanted. You know, of course we all wish that we could like have a menu where we pick out exactly how it goes. Like, I hope it's on this day and it's the labor's this many hours long, and this and this and this happens, and this doesn't happen. You know, so it wasn't what I would have dreamt of for, you know, an ideal birth situation. I definitely did not want to be in labor for such a long time. It was really hard. It was really painful. It was scary. It was hard. And I, you know, got an epidural, which by the time I asked for it, I wanted it, but I was hoping to not need one. And it just, yeah, it didn't go exactly the way I had dreamed, but it definitely went really, really well though, considering. And so I'm glad I got to experience spontaneous labor. I'm glad I got to experience a vaginal birth and immediate skin to skin, and the effortless bonding that helped facilitate. And just being able to look back at it, even though it wasn't perfect, it still was totally positive. There was nothing that was traumatic or upsetting about it. And so I will forever be super grateful for that experience, no matter what. Especially if this one doesn't go so well, because at least I got to do it the one time. Because it's not looking like I'll get to have spontaneous labor again this time. I highly doubt I will go into labor before 38 weeks. And who knows? I mean, I might not get to have a vaginal birth. You know, either things will just be too dangerous for that, or the induction won't work, or who knows. I'm prepared to advocate for myself and really push it that I am absolutely sure that I want to at least try, even if he doesn't think that it'll be successful. He's a little pessimistic about it not working. So I definitely want to put my foot down on that and say, I'm aware of the risks. I'm aware it might not work. I'm aware it's harder to recover from a cesarean if you are in labor first rather than scheduling one. But I still would rather at least try than go straight to surgery. He is an extremely VBAC supportive doctor. He is the guy in the area. He's the OB that all the birth center and home birth midwives refer to as their backup OB. He specializes in VBACs. He specializes even in vaginal breech births. Like, he is the guy. He's my best shot at this. And he's been an obstetrician for 38 years. Like, he's very experienced, he's very competent. I completely trust him. I trust that he knows what he's doing and that we're in good hands with him, and he's not going to recommend something that, including waiting, that is too dangerous for us to do. I'm sure if things got a lot worse, if my blood pressure got a lot higher, if I started having definite preeclampsia or just anything that was a lot more dangerous, and 38 weeks would be waiting too long, I'm sure he will change the plan and we will have him even sooner. But for now, I'm happy with the 38 weeks, especially because it gives us a little more time. We're still not ready for him. We're still doing the laundry and the shopping and just getting all the last minute preparations done. We're still, you know, trying to make arrangements with people. We have Justin's grandma flying up from the Bay Area, and she's coming during that week, the 11th through the 17th. So I really hope that we deliver during that week so that she's here to be with the kids, so that Justin can focus on staying with me at the hospital. I have had multiple people offer to watch the kids, and again, super grateful for that. Oh God, I'm getting emotional. but I feel like it's a lot to expect of someone to do for you, especially someone you don't know that well, who doesn't know you that well. And so I feel like that's really, I feel like it's kind of asking too much of someone. It's a lot to expect someone to do for you. So I'd rather it be family, if at all possible. But I know that us being safe is so much more important than anything that's convenient. And also, you know, the day after I turned 37 weeks is Justin's birthday, and he, you know, would rather not have his son share a birthday with him. And, you know, some people like that. They want family to share their birthday, and some people don't. And neither one is any less valid than the other. He'd like to have his own birthday, and I don't blame him for that one bit. And if we were to have to induce at 37 weeks, it's quite possible that he would be born on his birthday. So I definitely hope we can make it at least closer to the 38 mark. I'm scared about him being early and having problems with breathing and feeding and things like that, especially because of the gestational diabetes that can suppress the production of surfactant. Gestational diabetes babies who are born even 37, even 38 weeks can sometimes have trouble breathing because of that. And so that's really scary to me. I'm really hoping he's not going to end up needing to be in the NICU. I'm really hoping he's not going to end up having blood sugar issues. I'm just really nervous about how this is all going to go, because it's just so, like, we're teetering, right? Like we're basically on the teeter-totter here, trying to balance the safety for him and the safety for me. And going too early messes with that, going too late messes with that. Trying to keep us both as safe as possible is a big undertaking, and it's just really scary and stressful. And I hate that this is happening so early, because I know just historically that things get worse and worse for me as it goes. And so I don't know how sick I'm gonna be in a week from now, 2 weeks from now. That's a really scary thought. In the meantime, we're trying to get as prepared as we can. Things are falling into place so perfectly that I feel like it's just God's plan for us, that he's got his hand on this and it's all working out because he's working it out for us. And so as much as this is scary and everything, I also just feel really at peace, and I just feel really hopeful that it's going to work out, because I just know we're in his hands, and I know we're in good hands with my doctor, and we're in good hands at the hospital I'm delivering at. They have the best NICU in the area. I know that, I just have faith that everything's gonna be okay. And I know my body can do it. My body has birthed a baby before. I don't see why it couldn't again. So I'm just trying to hold on to that. I'm trying to hold on to faith and being positive and being optimistic. And I just want to stay in that headspace, because I know that is such a crucial headspace to be in when you're preparing for birth and when you're in the birthing process. So that's the plan for now. Let's go ahead and do that belly shot. He is estimated to be 6 pounds on the dot in the ultrasound. So he's 80th percentile. So yeah, on the bigger side of average, but still within average normal size range. And his head is still measuring bigger than his belly, so that's good. So again, they're not worried about a shoulder dystocia risk, because he's still growing in the right proportions and along just about the same growth curve. So we'll see what happens at the NST this week. I plan on making a lot more pregnancy related videos. I actually have a couple of different ideas surrounding gestational diabetes. I have a couple videos I need to show you about some of the stuff that we've bought for the baby, you know, some clothes that we got for him, and my newborn cloth diaper stash, and just all kinds of fun things to show you over the coming weeks. So I'm going to be doing a lot of batch filming over the next few days, so I can have all that content ready for you. So probably some of that stuff will probably not even go up till after he's already born. So just, you know, heads up that it might be weird and be like, wait, why is she still pregnant in this video? Because I'm pretty sure he's supposed to be born by now. And that's just because I want to get ahead of it and have some content to put up for you, because I know I probably won't be having the time to film and put up new content right away. So thanks so much for watching. I appreciate each and every one of you. See you next time. Bye.